Good morning, everyone. My name is Amy Carrera, Shield Healthcare's corporate registered dietitian. Welcome to our webinar, Parenting a Child with Special Needs. We're having a roundtable discussion today for about an hour. All attendees will be able to ask questions. The webinar will be in listen-only mode, so to ask a question, please type it into the question box in the control panel on your screen, and we'll have a question and answer session at the end. The webinar will be recorded in case you miss any part of it. You can go to shieldhealthcare.com/webinars after the live event to see it. You'll also find a copy of the slides on your control panel on your screen. And without further ado, I'm happy to introduce our moderator today, Alethea Mshar. I'm going to let her tell you a little bit about herself. Take it away, Alethea.
Hi, I am Alethea Mshar, mostly called Lee, and I'm here today as one of the writers for the Grow with Shield Healthcare blog and mother to two children with Down syndrome, one of whom has apraxia of speech, and the younger of the two is on the autism spectrum and has multiple complex medical concerns, including Hirschsprung's disease, cyclical vomiting syndrome, and he is a leukemia survivor as well. So I have a lot of experience both in the developmental disability realm and in the medical realm, and I come to you today to share that and to get lots of good other information from our other panelists, next to which is Jamie Sumner.
Hi, I'm Jamie Sumner. I am an author and writer and mom to a son, Charlie, who is 6, and he has cerebral palsy and a syndrome called Beckwith-Wiedemann syndrome, which is an overgrowth syndrome. He's in a wheelchair, and I talk a lot about him when I write for Shield Healthcare, and I'm happy to be here and talk with you all today and answer questions and talk about all the things we always want to talk about and need to talk about with other parents of kids with special needs.
All right, and next up is James, or Jim Leach, and he is a personal friend of mine. When I worked for the Down Syndrome Association of West Michigan, Jim was on the board of directors and extremely active with the dads group and very passionate dad. I'll let him introduce himself.
Yeah, good morning, everybody, or afternoon. My name is Jim Leach. I'm from Grand Rapids, Michigan. I have a typical daughter who is 7 and a son who has Down syndrome. He is 5. I am active in the Down syndrome community, especially with the Dads Appreciating Down Syndrome group. I hope to bring a little bit of a different perspective. Typically moms are more involved in the day-to-day aspect, and dads have a different role. So hopefully I can help answer some questions, shed some light on what it's like to be a father of a child with special needs.
And our last panelist is Dr. Liz Matheis, and Dr. Liz is also a parent, and she wears another hat as a clinical psychologist, and I will let her introduce herself.
Hi, I'm Dr. Liz, as everyone likes to call me and likes to be called, because I feel like Dr. Matheis is way too formal, and I'm not a formal person by any stretch. I'm a mom of 3, and my daughter, who is smack in the middle, she has special needs. She's dyslexic. She has sensory processing disorder. She's painfully anxious. Not to say that my other children are not anxious, but hers anxiety is really the most debilitating. I am an anxious adult and was an anxious child and adolescent and young adult. And then I'm also a clinical and school psychologist. So I specialize in working with children with anxiety as well as ADHD and autism and learning disabilities. My areas of specialty, ironically, came first, and then my child came into my life. So even with that, I feel like it took some time to see it because it was too close to home. But I'm also here to, as part of this awesome panel, to discuss what it's like to be a mom and a professional in the field.
Great. So we're going to go ahead and start asking the questions of our panelists here. And the first question is regarding the spoon theory. Now, the spoon theory is something that was developed by, I believe, a woman with a disability and a chronic illness. And her theory was that if energy was spoons, each person gets a certain amount of spoons in order to go through their day. And she's saying that, if a typical person gets about 50 spoons to get through their day and to use each spoon for one task, then a person with a disability gets maybe 12 spoons or maybe less, give or take, depending on the day and how well they're feeling, or a person with chronic illness. So I extrapolated from that a little bit further and saying that as a parent of a child with complex medical issues and developmental disabilities, I have what you might consider a typical number of spoons, but since I have to use so many of those in the care of my child, that I have fewer to give to the rest of the world and for self-care and that kind of stuff. So jumping off from that, panelists, how do you manage your time and energy? How do you manage your spoons as a parent of a child with special needs? Who's going first?
I'll jump in. I think for me, the biggest thing that I had to learn, especially when Charlie was young, because he had a trach at that time and a G-tube and was just more medically fragile than he is now, is I think at first I expected myself to be able to do everything that everyone else and because he was my first, so everything else I saw new moms doing with their kids, I just expected to be able to do that. And then when I couldn't, I felt a lot of guilt that I couldn't keep up, I guess. So the thing I had to learn was to understand that I didn't have as many spoons. It's not something that I was choosing to not be able to do everything everyone else was doing. I just couldn't. And then I had to learn, this was the biggie, then I had to learn to communicate to the people around me that didn't quite understand the situation I was in. I had to learn to communicate that I just sometimes can't. It's not that I don't want to be able to do all these things that I used to be able to do, but I just can't. And that's okay. I've got to be a mom. I got to take care of myself. And there's just so many hours in a day. And once I got better at explaining it to other people, it became easier for me to deal with.
Okay. Anybody else want to speak to that?
Some days, at least in our household, some days are better than others. My son has a feeding tube as well, so he gets bolus feeds 5 times a day throughout the course of the day. And where I struggle, and so, using the spoons as that unit of energy, right? So, I mean, that is dedicated energy on my wife and I's part every single day. Where I sort of struggle is the whole idea of being able to ration spoons or save spoons, especially for my typical daughter, because Corbin gets so much energy and time, and it's necessary. That you talked a little bit about guilt, Jamie, that you feel guilty that I'm not leaving enough time and energy for the other people in my family that need that love, time, and energy. So but each day is different. I mean, there are times when I come home where I have a lot more spoons, and some days I come home and I owe the bank spoons that I spent today. So it's very fluid, and we have learned that that's the way that it's going to be in our household. There's no black or white. There's a lot of times in the gray. So
yeah, I also live very much in the gray in that we all work and we all need to give so many spoons to that. And for me, being a mom of 3, my 3 kids couldn't be any more different. My daughter requires the most spoons because I have to constantly self-regulate. I have to constantly check myself. And on those days where I'm not, where I'm fatigued or I'm stressed or whatever, I really have to check myself constantly, because when I'm not on, she's totally off. And behaviorally, she is very, very challenging, and she does consume the most number of spoons in our home. And so in line with that, it's making sure that there's enough time and energy and spoons to be able to give the other two children, my spouse, our home, and my practice. And so I feel like no 2 days look alike ever. And it's just whatever today brings, and I'm learning to kind of just go with it and be flexible in that respect, because I do like a routine. I like to do things in a particular way, but I feel like I'm very consistently derailed. And at some point you have to adjust to that. So
yeah, I find one of the things that happens in our home is my husband, when I'm, had a stressful experience, or, something's going wrong, run into the doctor, that kind of stuff. He knows to shoo me out of the house so that I can get a little fresh air, get a little exercise, and come back with my brain organized. He can tell when I'm getting to that point of, it in debtor's prison with the spoon debt, and that's where it comes in. For us, is making sure that we tag team in order to make sure that we're both managing things together. Now, another thing that I've written about is something called the ring theory, and this was developed by a woman who had breast cancer, and she's finding, she found that when she was in the hospital, people would visit her and they would be disturbed by the tubes coming out of her body after surgery, and kind of just blurt things about how upset they were for her. And she realized that we need to have a system for us for organizing a support system. And so she developed the ring theory. And a person who is not well or has a disability is at the very center of the ring. And you can see the graphic on your screen. And as a parent or caregiver, we're at the closest outside ring. And then, we have to establish people, in each of the rings. But one of the biggest principles of this ring theory is that you can dump out, you can vent, you can say anything to anybody further out of the ring, which gives the child, in our case, the ability to dump out to anybody, but only comfort in. And this is something that one of my family members has put out there in order to kind of create a paradigm for our family to understand that they can't vent to me about how they're frustrated about my life and my child and those things, or that they're upset that my child's sick again or whatever. So using this graphic and this system, how do each of you, who's in your support system, who's in your closest ring, who can say anything to you, and how do you manage it when people who are on further out rings are dumping in?
I guess I'll start on this one. At least I think for our family, the biggest struggle is communicating to friends and family about exactly where they are in the ring, because there's sometimes that I think people think they're closer in to the ring than they might actually be, and vice versa. There's some people that may not be comfortable knowing that they're on the inner ring. But the one part that I guess, at least for me personally, I totally I love the idea of comfort in, but I'm not a big guy of dumping out, so I would most likely dump within my circle. So and I guess I don't know whether that's just me personally, or maybe some other panelists can speak to that, but usually I vent to my wife, I'll vent to siblings, parents, people within my ring, and not outside. But that could be just me.
No, I second what Jim said. I have to feel really safe with whoever I'm sharing information with in order to be fully honest and vulnerable about whatever's going on with Charlie. So it's typically my husband in that same circle that I'm in that I'll share with. And then the nurse that took care of Charlie in the NICU was his primary nurse in the NICU, she's my best friend, and she's also a nurse in the NICU. So she's known Charlie for as long as I've known Charlie. So she's my other person that I can vent to. They're both less emotional people than me, and they can handle it, and so I feel safe with them. But I also agree with Jim in that it's hard to tell people where they are on the circle and not cause offense. So I also relegate that to my husband to tell people, I'm not great at conflict, and he is so diplomatic that he can do it. And I've discovered he's my person that can do that when it comes to Charlie. And that's kind of how we've made our in-out circle.
Yeah, and that's how my sister did it for me. She realized that, other family members and other people were telling me about their stress about my child, and that it was adding more weight to my own stress. And so my sister actually took that role and said, hey, look, we need to follow this. Dr. Liz, do you have any insight on this?
I from a very personal perspective, I'm not really sure if the field chose me or I chose the field, but given that I'm the person who's always being dumped on, right? Because that's part of my job, is to sit here and to hear it all. I really have a hard time dumping out. And so it's taken me a very long time to feel comfortable. And there is that level of vulnerability, because I think it just very inherently there's a sense I'm being judged, that I'm not doing something correctly. I don't think anyone really fully understands just the amount of energy that goes into taking care of a child with special needs. Unless you're doing it, I don't think anyone gets it. And so I think right now the person who gives me the most support, where I feel the most comfortable dumping out, is my own therapist. And that person really comforts me, validates me, but otherwise it's really hard. It's really hard to find those other people, and maybe it's just me. I'm having a gym experience here. Maybe it's just me. But unless you're in it, you don't. Mm-hmm. Other people really I don't think they get it. I think because we're always looking at human nature is to find like a source of blame. And find the source of like, why did this happen? Well, then you must have done something wrong, whatever the case may be. And so and maybe this is my own sensitivity. And I'm open to that, and I'm happy to really put it out there.
Have you tried this essential oil?
What's that?
Or have you tried this essential oil? Because that'll fix everything, right?
Oh my God. Right here, like I love essential oils, but essential oils are not going to they're just not going to. I can do.
My child has cyclical vomiting syndrome, so peppermint oil is not going to fix that. It's not. I know it's good for nausea. It's not going to fix cyclic vomiting syndrome.
Lavender is not going to calm her down.
Yeah, it doesn't. It doesn't.
I'm happy to sniff as much of it as I can, just to give me the strength to cope with the whatever. But
even if it's placebo effect.
Whatever, I'm open to that. Placebo away.
Oh yeah. Yes. Yeah. So, and I also find, I'm reluctant to even dump on my husband, because I know that he's right there with me, feeling that stress, and I do. I have a therapist that I see, and sometimes I yell, sometimes I cry. That's a very good place to dump out. Dealing with guilt. We've been talking about this anyway, but there's that internalization of guilt. There's that always wondering if you're doing enough. Like I well over a year off of all therapies outside of school for my kids for a number of reasons. And the whole time I was just agonizing over, if I was doing the right thing, if I was, you know, and now that we're back in therapy, I'm like, yes, this is, you know, we have a fresh start, we have more traction, we're doing so much better with all of this therapy stuff. But it just really bogged me down in the back of my mind that I wasn't doing everything I'm supposed to do for my kids. So who has feelings of guilt like that, and how do you deal? Dr. Liz, you want to go first this time?
I think I'm always struggling with those feelings of guilt. Am I doing enough? Am I addressing enough of each element of her areas of weakness? Am I building her up where she needs to be built up? And then the guilt that comes with, wow, I'm investing a lot of time and energy into her and their 2 other kids. You know, I'm not doing for the youngest what I did for the oldest and the middle, because unless we can build another 3 hours per day, I don't know how to do it. So those feelings of guilt are real. They're every day for me. And, you know, I have to always check in with myself and say, am I doing the best that I can? And I got to let go of the guilt, because it drains me of the spoons that you know, it takes away too many spoons for me. And I need to preserve some of that, because I'm realizing how much downtime, how much I crave that downtime, and I give it to myself at the very, very end of the day when everyone is asleep. And then I go into the wee hours of the night trying to give myself that downtime, and that stinks, because now I'm not getting enough rest. So I'm depleting myself of spoons while I'm trying to give myself spoons, and it's like, it's a hot mess.
I heard a quote recently, and it was, somebody said, an early bedtime is a parent's way of sleeping in. And it's like, because we always think, oh, we're giving up our night to go to bed earlier, but that's actually our best option. That is our equivalent to sleeping in. So it's not like a punishment. It's actually like your reward is that you get to sleep more. Yeah, that it makes me feel a little bit better about it, but it's still, you only get so many hours. And so by the time everyone's asleep, you want to just breathe and just not think about anything. Like, I don't even want to watch a challenging Netflix show. Like, I just need to be done. But as far as the guilt goes, so we have Charlie has a stander in our living room. Every time I look at that stander, I feel bad. Because when he's not in it, like, I just feel like, oh, I need to put his braces on him, and I need to be working with this, and I need to be stretching his legs more. And it's like a visual reminder that I'm not doing something. And I really felt this recently, because we're moving towards getting him a power wheelchair instead of a manual wheelchair, and that has just hit me really hard, because I'm like, is it because I didn't work with him enough? Is it because we haven't done enough work with the walking and also practicing making him wheel himself, that he just hasn't done it, and that by getting the power wheelchair we're somehow giving up in a way? And that surprised me how hard that hit me. But once again, my husband was really good about, we kind of talked through it, because I'm like, I don't know if this is the right thing. And the thing that helped me let go of the guilt is to say, with all these decisions, you have to weigh their health and their happiness and their quality of life. And the ultimate goal can't be to push them in every way possible, because if you do that, they're not going to be happy. They're not going to be, their life is going to be about work instead of about also enjoying who they are. And for us, moving to that power wheelchair is going to give him more freedom to concentrate in school, to hopefully stay up with his classmates once he learns to use the power wheelchair, so he can be more independent. So even though it seems like it's taking away his independence, it's actually giving him more. And a lot of the guilt stuff for me is about reframing the situation and considering all sides of who he is and what he needs. And it's not just about meeting milestones. It's about so much more than that.
And, you know, I think that's the same in our family, is that we do, I mean, we've got PT, we've got OT, we've got speech, we've got feeding therapies, you know, multiple times a week. And, you know, you do push. And then when you realize, or, you know, maybe yourself, you're like, you know, we got to take a step back. And then that's when the guilt comes in, because, you know, you feel guilty because we're trying to, at least for me, regroup, you know, in the process. And my wife is amazing in managing, you know, all of this stuff. So, you know, and, you know, she sort of, you know, carries the same feelings too. Am I doing enough? Are we doing enough? And I think it lands for us on how we deal with it is just realizing, and it's hard, it's difficult, that we don't have to be the best. We just have to be the best that we can be at that particular moment. And we have to keep reminding ourselves that. And that's sort of, you know, the way that, you know, that we try to deal with it, is just to keep reminding that, you know, we are doing the best that we can right now. And everything, you know, I think it's always hard to look long term. You know, we're always so in the moment, but, you know, eventually everything will be okay. And we just have to believe that. And that's sort of how we work through that guilt. So.
Yeah, I would agree with all of that. And the other thing, you know, I think Dr. Liz also touched on this, is, can I really afford to spend how many spoons a day on dealing with my own feelings of guilt? You know, we owe it to ourselves and to our children to use the energy and the time that we have responsibly, and not feeling guilty over little things. And I know another thing that I feel guilty for is when I miss my self-care. You know, for me, exercise is a really big deal. It literally makes me feel like I'm going from a complete fuzz brain to organized, cohesive, ready for my day, able to function. And I haven't been exercising, and then I feel guilty about not exercising. And it's just this big old spiral. And, you know, there just isn't time sometimes for me to exercise. I get out when I can, but it doesn't always happen. And I need to not add that extra layer of guilt to not doing that part of taking care of myself. So yeah, it's more of a big picture thing, for sure.
Feeling like that it's okay for us to take that time for self-care, because I know that I personally struggle with, you know, feeling selfish. Like, am I being selfish for wanting downtime? And am I feeling selfish for wanting to just go hide in the closet because I don't want any more requests. I don't want to make any more decisions. Like, there are definitely days, like multiple days, where it's in a row where I'm thinking, I just want to be, I don't want anyone to talk to me. I don't want anyone to talk to me. And then I feel selfish and I feel guilty for feeling like that. But I think it's that I want a mental break. I want to stop processing and planning and thinking about what that next step has to be. And there is no has to be. You know, I realize I create that for myself, and I have to build in the self-care if I'm going to make it.
Yeah. And sometimes that self-care has to look a little bit different than others. You know, if I cannot physically get out of the house to exercise, then what do I have to do instead? Rather than feeling guilty, you know, what can I do to replace that and make sure that I'm filling myself up a little bit? Next topic is comparisons. One of the things, you know, that always kind of got to me was right before our older son Alex was born, we moved into a neighborhood where there was a lot of young families, and many of them had children about the same ages as my children. So I was just constantly surrounded by children who were the same age as my children, but at very different levels, in different ways than my children were. And the younger kids would develop past where my children are. And I found myself playing the comparison game all the time. And it's funny now because people will ask me, oh, do you think my child is delayed on this or this milestone? And I'm like, I don't even remember what typical milestones are anymore. So, you know, there's that. Don't ask me if there are some really unusual things. That's where my sweet spot is, but I don't remember what typical milestones look like anymore, because we really just kind of brushed those right out of there and said, this is not what our life is going to be. But I think that's very normal to compare our children. What are your experiences with that comparison game, and the experience of, using a certain measuring stick with your children? Does that happen?
It definitely happens on my end, where I compare between my children, and then I compare to other children, and I realize there's nothing that good that comes out of comparing, because when we're comparing, we're not praising ourselves, and we're not acknowledging what we're doing well. So I have to always kind of come back to that point of saying, my child and each one of my children is going to follow their own unique trajectory on all their skills, and the developmental milestones, we can look them up in a book, but I don't really care at this point. They'll get there when they get there. There's no rush, and but it's very easy to get caught up with that, with other parents who do like to point out what their child is doing very, very well. And I think other parents are proud, but sometimes it can be very sensitive to that and feel like you're bragging and this isn't making me feel good. And so I will congratulate someone, but in my head I'm like, okay, this is making me feel like crap, and I don't like the way I feel right now, and I need to just kind of walk away from the situation. But yes, it's very easy to compare. I think from the start, from within our own life, we're always comparing. Well, this one rode their bike before I did, or this one did this. Just as parents, or as parents and as people, it's a very natural thing to do, but it doesn't serve any good purpose.
No, I agree. And what we've learned to do is celebrate the little wins. And sometimes that's easier said than done. I still, to this day, it's, especially if it's in my face, I'm comparing Corbin to a typical 5-year-old boy. It's right there in front of me. I mean, how can I not? It's just sort of how I'm built. But we like to celebrate the little stuff at home. It's Corbin gets 95% of his calories via the G tube. So if he can eat 2 ounces in a day, 2+ ounces in a day, that's huge for us. He's nonverbal. So if I come home and I hear a new word, like right there, that's a new one for us. Right there, right there. If we hear that, that's like massive. And those are the things that, I like to celebrate. So it's almost, comparing, now comparing Corbin to today as compared to Corbin, a month ago. And that is, I think, a better comparison and easier for me to manage and digest than looking at, a typical kindergartner running around and seeing what he's capable of doing. So
I like that idea of comparing. If you're going to compare, because we all do it, to compare Charlie to how he was a month ago, and to see those tiny bits of progress. Because Charlie goes to a special needs inclusion preschool, and he's gone there since he was 2. I actually see a lot of kids like Charlie with typical diagnoses or typical physical disabilities. So the hardest thing for me that I wasn't expecting was comparing to other kids with similar disabilities, because a lot of us started at the same time at the school. And I'll see kids that looked weaker than Charlie, who are now using their gait trainer or their walker, consistently down the hall when we go to school drop off, and Charlie's still in his wheelchair or whatever. And it's hard to see kids like that are a lot like Charlie surpass him. But I think the thing that I remind myself is that what I'm seeing is just what they're doing for a snapshot of time. And I'm not seeing their day-to-day life. And I know Charlie inside and out. And I know that there's so much more than just the physical, like there's so much more going on. And I remind myself, like, the comparison never works because you're only seeing, it's like you're only seeing every person in one dimension, and you can't make an accurate comparison then anyway. So that, to me, that idea that Jim brought up of comparing Charlie now to how he was a month ago or a year ago is so much better, because you know that kid, he's your child, you see him inside and out, and then you can kind of do that thing you do where you say, well, we've made progress here, but we haven't here, but you can still be encouraged by what you see rather than just, beat down by looking at other people when it doesn't even make sense to you.
Absolutely. Absolutely. Yeah. And yeah, I will say it's kind of funny because my oldest daughter is, neurotypical. And when she was younger, we tried all the sports, gotta get her into sports, like everybody does. Soccer, she literally is spinning around the dandelion in the field. And, T-ball, same thing. She's the way outfielder that, ball flies right over her head and she's not even paying attention. And I even got caught up in comparing her. She's 19 now, and I can see, I have a child who's a philosopher. She's, I missed the forest for the trees. She was busy asking questions and investigating her world in her own way. And the sports never meant anything to her. So I think it's easy enough to do that in every aspect. And I think it's just crucial to appreciate the child in front of you and not try to make them into anything they aren't. Lord knows I've made that mistake more times than I can count. So the outside world. A couple of weeks ago, I shared on Facebook a meme that said, instead of staring, if you catch your child staring, instead of saying, don't stare, say, hey, you want to say hello? And smiling and saying hello is just a great bridge builder to the, from the outside world and to the outside world. And the flip side of that is, if I happen to notice somebody who is staring at us, I can smile at them, and my children, say, hi guys. And that makes a big difference. So dealing with the outside world, have you had experiences where you've caught people staring, where people have said things that have made you kind of cringy? And do you have a go-to response, or is there an effective way of dealing with it that you've discovered or stumbled upon in your experience? You want to go first, Jamie?
Sure, yeah. I'm about to tell a story where my go-to response didn't work, but I'm gonna tell it anyway. So when Charlie was about 3, he gotten his trach out, and he didn't have a G-tube anymore, but he still didn't, he didn't look like a typical kid, because part of Charlie's syndrome is he has an enlarged tongue, and we'd already had tongue surgery by this point, but he still just would let his tongue hang out. So when you look at him, you can see that he doesn't look like other kids. And he was also riding in the top of the basket at an age where usually they're a little too big for that. And so it was obvious that he was different. And we were shopping, and there were these 2 boys who were probably 8 and 10. They seemed to be brothers. They could have been friends, but I kind of just assumed they were brothers. And they looked at Charlie, and they started kind of laughing and whispering. And what I had learned to do by this point is just to kind of say hi and draw them in. And Charlie by this point had seen them, and he was waving because he's Mr. Friendly, so he wants to wave at everybody. And so he was waving, but they wouldn't wave back. They just kept kind of laughing, and like they would look away and they would look back and laugh, and it was super awkward. And so I said, hey guys, this is Charlie. He wants to say hi, kind of expecting that they would just be like, hi, and kind of go along their merry way. Well, they didn't. They didn't say hi. They kept laughing, and their mother, who I think was their mother, was with them, and she noticed, but she was embarrassed or she didn't know how to handle the situation. But instead of engaging with us and bringing the kids into a conversation with me and Charlie, she kind of laughed a little and looked away. And that threw me. That absolutely threw me, because you expect the other grown-up to kind of have your back.
Mhm.
You just kind of assume that. And so when she didn't, I just got real flustered. And quickly went to another aisle. I ended up seeing them later, and it happened again later in the grocery store, which I should have just left. I should have just left at that point. But luckily, Charlie was fine. Charlie didn't even notice. He just kept waving at new people. I've learned since then that the best way to kind of deal with those situations is to actively bring the other grown-up in. Like, she might have been embarrassed and just reacted badly. I should have said, "Hi, ma'am, this is Charlie. What are your sons' names?" And then it would have been a less awkward situation, and I wouldn't have left with such a bad feeling. But even when those situations happen, the thing that I remind myself is that Charlie is not as affected by it as I am. Luckily, it happens to us, but I tend to feel it more than him, which is a bit of a comfort to me. But anyway, since then I've learned it's better to also bring the parent in and not just the kids, if it's the kids you're dealing with in that situation.
Mhm.
Yeah, I think it's also it's very frustrating and very hurtful when you do hear when you see the responses, and we begin to make assumptions about what the other person is thinking about us or a child, and it's that feeling of being judged, and it's very uncomfortable. And I'm personally trying to just say to myself, I may never see this person again, and their opinion isn't going to define me in the moment, which is easier said than done. There is a lot of things that other girls my daughter's age are capable of, and she won't do them or can't do them or is not comfortable doing them, and not being included and not being invited, and all these things kind of come into play. And it's just a matter of, for me, I'm just learning to say this is who she is, and kind of dealing with it more internally, and just moving on, because I don't know what's going to come with me. Like, I want to use my energy more efficiently.
Mhm.
With me, and I think it's just my personality, is that I at times, most times, feel it's my obligation to make the other individuals feel comfortable in order to facilitate a positive interaction. So I usually am very proactive in those situations, especially when Corbin's getting tube fed. If we're out and about, Corbin still needs to eat. And we're not bashful about it. I sit down and my wife sits down wherever we're at, and we typically get a lot of looks, which is great. And I'll try to invite kids over that are very, very curious, and explain this is the way that Corbin eats, and here is why. But I feel that is my responsibility to, I don't know, maybe be a teacher, facilitator in that way. But the one thing that somebody said, just a quick story that I thought was inappropriate, is someone said to me one time that, your son doesn't look like he has Down syndrome. And, the greatest response that I ever heard that I use now is that, it's his off day. So that's one that I go to now. And I find it's enjoyable, and I get varying reactions, but how do you respond to that? Your son doesn't look like he has Down syndrome. Well, pretty sure that he does. The says that he does. So, but
Right. And I know, when our older son was born, we got the diagnosis after he was born, and so many people would tell us, "Oh, I'm so sorry."
yeah.
And we had close friends who had a stillbirth while I was pregnant with him. And so for me, there was perspective right away of, no way. My son almost died in birth. It was a traumatic birth. He had to be resuscitated. He has, some traumatic brain injury from it. And to me, it was a no-brainer. I have a living, breathing baby here. Down syndrome is something we can live with. So, trying to reframe that of, what? People live long, happy, healthy lives with Down syndrome. That's not something that we're sorry about. It's our new normal. Welcome.
Yeah.
So, I think there's a lot of ways to help other people. When we learn to reframe things ourselves, I think we can help the rest of the world jump on with us and reframe too. And I think that's really important as ambassadors, really. Part of our advocacy is being an ambassador to the outside world so that they can see that our lives are really, with all of the challenges and all of the extra stuff, they're valuable and worthy, and that's the bottom line.
Okay. Absolutely.
Moving on.
I think you make a really valid point there, that even though our lives are different, they're just as fine and normal and valuable and awesome, in different ways. And I'm being that I get the chance to hear about what goes on in people's thoughts and homes. It's really, you never know what's going on behind closed doors. And I really hold true to that, is that, someone present things in a particular way, but what's really going on, no one knows.
No, agreed. Moving on to the birds and bees, a topic that in my opinion, in some ways I wish I had been a little bit more on top of when my kids were younger. But a very important topic, and something with all of my children that I've really tried hard to just be real open about. It does change when your children have developmental disabilities. For example, both of my boys with Down syndrome do love to hug. Some of that is self-regulating. Hugs are deep pressure, and when your sensory processing is a little bit, needs that activation, a hug can make you feel really good in the moment. But I've had to teach them, and we probably should have started a little bit younger. I have a 16-year-old boy, and people don't want unsolicited hugs from 16-year-old boys. I don't care who they are. So we've really had to help our son Alex learn that you can't greet somebody you're just meeting with a hug, that you have to fist bump, that you have to shake hands, you can, where you can touch, where you can't. And, we've used a variety of social stories and all of that, but talking to children with developmental disabilities about consent, where to let people touch them, about other people touching them, where to touch other people, appropriate touch, inappropriate touch. How do we go about that? And I'm going to start with you, Dr. Liz, because I know you've worked with this both with your own children and professionally.
So I had worked in a private school for kids on the autistic spectrum, and this was a big one for our adolescent males and females. They got to that point where their bodies were changing, their chemistry was changing. They felt a sense of, that physiological reaction when a boy or a girl walks by, and a lot of them were confused and scared by it. And it was, I think, engaging them and helping them to, as best as they could, understand that their body was changing and it was normal and it was okay, but making sure to give them the understanding of that, there's certain things we do in private and we don't do around other people. We go to the bathroom, we go to our room, it's private, and that's okay, and it's perfectly normal. A lot of our children, when they go through puberty, they may talk to each other. They do have the health education classes built into their school time, and they take that all in and as best they can, and they come home and ask questions. But I think for many children, that's a tough one. Understanding my body's changing and what does that mean, and why do I feel this way? So I think it's important to address the individual questions and concerns of the particular child. And if they don't have the questions, maybe to begin to interpret as to what they may be feeling by what we're seeing is happening for them behaviorally. And to really validate and normalize their puberty experience and their physiological changes. They may notice I'm growing body hair, and to address that and to point it out to maybe other people, like whether it's in a book or a social story or a magazine, that it's okay for other men to have body hair and this is normal, or for girls who are going to begin to menstruate. That's really scary. The whole idea and the whole concept of I'm bleeding is very scary, because I think all along we've associated the bleeding to something's wrong. And this is the one time you're saying nothing's wrong, this is okay. So I think it's a lot of creating scripts and formulas for how to interact with others, like you said, the fist pump, the handshake, the side hug, and normalizing their experience and maybe addressing their specific areas where they may have questions or are noticing change. And it's just, I really feel it's a lot of normalization, because I don't think they always know that this is normal. It just feels different. It's really a very different physiological response and reaction to them. And the other thing is engaging the parents, so that there isn't the, what are you doing? Or what are you, especially if there's just like exploration of their body and different areas of their body that are considered private, and understanding these are private body parts, and that only mom and dad and pediatrician takes a look, and understanding that we keep those parts of our body clothed, and for, as we get older, girls they wear bras, and for, when they're developing and so forth. But I think it's step by step, and I'm always a big fan of answer the question or area of concern that is coming to you, and don't go too big, because then it's too much information and it's overwhelming.
No, for us, we have used social stories, and the school social workers and school psychologists have been extremely valuable resources in helping us find or make social stories. I don't know how to make a social story myself, but I do know who to ask to help get a social story for my children. Jim or Jamie, do you have any thoughts on this? Younger than mine.
Yeah, so Corbin's 5, and this is something that my wife and I have discussed a lot, because we're scared, because Corbin is nonverbal, and how, if something does happen, how is he going to communicate that with us? How do we communicate? I mean, right now, he has no, concept of that social story. So, we're, and I don't know, I guess I defer to the rest of the panel as to when, this conversation can start. And I think, at least for us, it's when we feel the comprehension might be there. But, we're scared. And, he can't tell us if something is going on. And, especially with him still working through potty training right now, and relying on paras and relying on teachers to help with the potty, I mean, and we love, all of our paras and all of our teachers and trust them, but still, I mean, that is a situation that can lend itself to, something terrible happening. And so I don't know, it's very scary for us right now.
Yeah, I would agree. Our son Ben has to be catheterized for urine, and we actually made the decision to have a stoma put into his belly button for him to be catheterized, just because we didn't want to normalize people touching his penis.
Yeah.
And it is scary, because he can't tell us what's going on. The other thing, I say I wish we had started younger. Just reading those stories about where you can be touched and that kind of stuff. And the repetition, if they don't understand it now, they can start, it can start the conversation, whether it's verbally or just getting those concepts into their mind. Even if they can't fully understand them right now, just a really simple story about touch. And we have them for bed. The other thing we use is we use hula hoops for helping them learn about personal space, because again, I think some of it is a sensory thing. My boys tend to get in a little bit too close, and I have a extra super large personal space bubble, so I'm very sensitive to it, which may be beneficial for them. But just helping them understand that when you walk up to somebody, this is how big of a circle you should give around them, a very physical thing, to teach them about personal space, and lots of repetition with fist bumps, handshakes, where to touch, reminders, reminding them before we go out, now remember how you say hi, remember. And it can be very time consuming to help them learn, because it takes a lot of repetitions, and because their natural desire is to do something that might not be as socially appropriate. And it's really important for them to be able to conduct themselves in the most appropriate manner possible. Jamie, did you have any thoughts on this, or?
The only thing I would add for us, because Charlie's 6, so he's still pretty young for this as well, but he is starting kindergarten in 3 weeks, I think, maybe 4. It just gives me heart palpitations to think about. And it's a big public kindergarten, and it's not his little small town preschool where we know everyone, and he is not potty trained. Mm-hmm. And so there's strangers that we don't know. And part of what we have talked about, my husband and I have talked about, is Charlie has a speaking device that he's learning and working with, and he's getting better at. He has a Toby. Mm-hmm. And so part of what we plan to do is, start with the social stories, and also just actual books for him, because he can read pretty well. To start going through stuff like that, and adding some buttons to his speaking device so that he can, after we tell him what is appropriate and inappropriate, give him a way to tell us back what's going on when he's at school. These speaking devices take a very long time to master, so he's not great at it. So this is going to take years to be able to do. But I think putting it in place, or having some way at least for him to understand that he can communicate these kinds of things to us, and should, makes me feel a little bit better that we can at least put a plan in place, even though, yeah, it's scary. I mean, it's scary to send him off into the big wide world and have him have to figure that out some when I'm not there, but I think every parent feels that, or hope so. So I'm not, all alone.
No, you're not alone.
All right, moving on to a wish list. We're making it an inclusion-based wish list. Specifically for your child, are there inclusion wishes that you have over the next few years for them?
I think my biggest wish, since I was just talking about this with Charlie starting kindergarten, is because he's mostly nonverbal, it's very hard for him to make friends in the normal way. And so more than walking, more than even mastering his wheelchair, my biggest thing is that he can make a friend. And helping him use that speaking device to find a way to speak, or to use more of his signs or the few words he can say to really interact with somebody else that's his age. He's pretty good at interacting with his aides and his helpers because they know how to come at him, but kids his age don't necessarily do that. So what I pray for, and what I really want to work with it for him, is to help him find a friend.
Ditto here with Corbin.
Right?
Yeah, exactly.
Anybody else have any thoughts on that?
I think in terms of my my daughter, I just wish her to have more of just an inner quiet, because I feel like her world is so bombarded with her sensory, and I didn't mention she also suffers from Epson seizures, and knowing that she does. So she just that internal worry for her all the time. She's constantly surveying the environment. She's constantly worried about seizures and constantly worried about the world being overstimulating, and being worried about her learning and being worried about everything. So I just wish for her to have even moments where her inner world is a little bit quiet. She processes too much.
That's hard, especially it's hard as an adult. And I think you, have mentioned that you can be very sensitive and have some anxiety. So I'm sure you feel her pain.
Very much, very much. And I take on other people's stuff, and I have to constantly. And I don't know how you even begin to do research to validate a theory like this, but I'm a big believer that when you're an anxious, sensitive person, you have this ability to feel other people's feelings. And the one thing, I mean, it took me forever to realize this. And like, here's like a key thing. I walked into a PTA meeting a couple years ago, and I sat there and I was like, I can't breathe. I'm so anxious, and my whole physiology is so off. And I'm like, what am I anxious about? And I had to stop and realize I wasn't anxious. I was picking up on other people's anxiety and other people's energy. And it definitely goes both ways, where I can pick up on people's positive energy and I'm energized by it, but I also pick up on people's negative energy, and then I absorb it, and I have a very hard time differentiating what's mine from what's not mine. And I realize that a lot of the children and adolescents that I work with in the practice, as well as my own children, do this. They go into environments, and when you're a part of a classroom, you're taking in a lot of energy. You're taking your teacher's energy, you're taking your para's energy, you're taking your classmates' energy. And then if you're migrating other areas of the building, you're picking up their energy. And it's a very hard skill to teach children, because it's a lot of self-awareness. It's a lot of surveying. How am I feeling? What am I feeling? Is this mine? And as adults, we have a hard time doing that. So to encourage our children to do that, that's going to take a lot of work consistently over time.
Mm-hmm. Yeah, and especially if there are cognitive impairments, that change the way they process language and conversations, and that kind of stuff. Just layer upon layer upon layer of how to unwrap that and help them understand what's going on inside. And also to help them understand that it's not their fault.
Yes.
I'm like you. I internalize my own, but then, if I'm with somebody who's very extroverted and vents, I internalize theirs too. So I really feel that, and I see that happening with my children. And in some ways, I hope that being able to have a feel for what's going on with them helps me be able to help them unravel it too, because I do know what it feels like.
And I think also just understanding that as their parents, we're going to take in a lot of whatever area of struggle they may be having in the moment, their frustration or our own interpretation, and understanding that, and then learning how to work with it so that it doesn't drain us of our energy.
And they can pick up on our energy too. And that's another hard one. Even when, if I'm trying to stay positive, if my energy is just that tense vibration, my kids pick up on it. Even if I can keep the smile on my face, they feel that vibration from within, for sure.
It's funny because my children, well, like in those moments where I'm really trying in a very flimsy way to keep it together, and I'm going through all the motions, my children will say to me, "Are you okay?" And I'm fine. Actually, I'm not. I'm not fine. I'm really trying to pull it together, and I can't.
And you know what? If you're modeling that, maybe they're going to see it and feel more free to be able to say it themselves, which, bravo.
Yeah, I hope so. Like, you know, it's when it's your own emotional stuff, and it's in your own home. You don't. I feel like I don't have that perspective, and I'm sure you guys don't either. And we're so hard on ourselves.
We are.
We are. We're all doing such an awesome job, and we're taking care of our own children and you know, helping others and other parents. And so I really feel like we need to commend ourselves and give ourselves those kudos, because I don't think we do that enough.
Thank you. I think you're right. Questions from the audience. Amy.
So thank you all. I want to thank our panelists and our moderator, Alethea, for doing such an awesome job on handling these topics and talking about their experiences and answering some really thoughtful questions. We do have a few questions from the audience. However, in the interest of time, I didn't want to stop you guys because you're all doing such a great job and the information you're providing is like gold. I didn't want to stop you for questions. We do have a few questions. However, I think what we're going to do is maybe email them over to the panelists so that we can get some answers that way and then respond to the audience members by email. So that's what we'll go ahead and do. So we will get your questions answered by email. Thank you for everyone who's asked a question. I want to thank all the attendees for hanging out with us this morning or this afternoon, depending on where you are. And I want to invite you to visit shieldhealthcare.com/webinars to find the recording of the webinar, as well as other webinars that are coming up with Shield Healthcare. Thank you again, everyone, and have a wonderful day.
See you guys.
Bye. Thank you.
No.